Nurse Aide Test Prep Discount Code. Question 1. How should the nurse aide communicate with a client who has a hearing loss? Option A. Face the client when speaking. Option B. Repeat the statement. Option C. Shout so that the client can hear. Option D. Use a high-pitched voice. The correct answer is option A. Face the client when speaking. Facing the client when speaking allows them to read lips and see facial expressions, which aids communication. Shouting distorts sound, and high-pitched voices are often harder to hear for those with hearing loss. While repeating may be necessary, facing the client is the primary strategy. Question 2. What is the first sound heard through the stethoscope when taking blood pressure? Option A. Diastolic pressure. Option B. Systolic pressure. Option C. Pulse pressure. Option D. Pulse deficit. The correct answer is option B. Systolic pressure. The first Kurokoff sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 3. When making an occupied bed, the nurse aide should: Option A. Roll the client side to side, working with one side at a time. Option B. Have the client sit in a chair. Option C. Make the bed with the client on one side only. Option D. Ask the nurse to help. The correct answer is option A. Roll the client side to side, working with one side at a time. Making an occupied bed involves rolling the client to one side while changing linens on the opposite side, then rolling to the other side. Having the client sit in a chair is for an unoccupied bed change. Question 4. Normal adult respiratory rate is: Option A. 8 to 12 breaths per minute. Option B. 12 to 20 breaths per minute. Option C. 16 to 24 breaths per minute. Option D. 20 to 28 breaths per minute. The correct answer is option B. 12 to 20 breaths per minute. The normal adult respiratory rate is 12 to 20 breaths per minute. Rates below 12 indicate bradypnea, above 20 indicate tachypnea. Both require reporting to the nurse. Question 5. A client with Alzheimer's disease gets upset because they cannot find their deceased spouse. The nurse aide should: Option A. Remind the client that their spouse is dead. Option B. Gently redirect the conversation to a pleasant memory of the spouse. Option C. Tell the client to stop worrying. Option D. Call the nurse to explain the situation. The correct answer is option B. Gently redirect the conversation to a pleasant memory of the spouse. Redirecting to a pleasant memory validates the client's feelings while avoiding the distressing reality. Reminding them the spouse is dead may cause repeated grief. Dismissing their worry doesn't address the emotion. Question 6. When counting respirations, the nurse aide should: Option A. Tell the client they are counting breaths. Option B. Count while appearing to take the pulse. Option C. Count for 10 seconds and multiply by 6. Option D. Count for 30 seconds and multiply by 2. The correct answer is option B. Count while appearing to take the pulse. Counting respirations should be done without the client's knowledge because conscious awareness can alter breathing patterns. The nurse aide should keep their hand on the client's pulse site while counting breaths to disguise the activity. Counting for 10 or 30 seconds is acceptable for regular respirations, but disguising the count is key. Question 7. A client tells the nurse aide that they want to harm themselves. The aide should: Option A. Keep the information confidential. Option B. Tell the client that they are being silly. Option C. Report it to the nurse immediately. Option D. Promise the client that everything will be fine. The correct answer is option C. Report it to the nurse immediately. Statements of self-harm are mandatory reporting. The nurse aide has a legal and ethical duty to report this immediately. Confidentiality does not apply when there is a risk of harm. Question 8. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A. Rubber sheet. Option B. Air mattress. Option C. Emesis basin. Option D. Restraint. The correct answer is option B. Air mattress. An air mattress, or pressure-reducing mattress, helps prevent and treat pressure ulcers by redistributing pressure on bony prominences. Rubber sheets can trap moisture and increase skin breakdown. Emesis basins are for collecting vomit. Restraints are not used for pressure sore prevention. Question 9. When documenting client care, the nurse aide should: Option A, use vague descriptions. Option B, be objective, accurate, and use only abbreviations that are approved. Option C, include opinions about the client. Option D, write in pencil so errors can be erased. The correct answer is option B. Be objective, accurate, and use only abbreviations that are approved. Documentation should be objective, accurate, and use only approved abbreviations. Opinions are not appropriate. Pencil should not be used. Documentation should be in ink. Question 10. What is the correct way to transfer a client from bed to chair? Option A, pull the client by their arms. Option B, use a transfer belt and proper body mechanics. Option C, lift the client under the armpits. Option D, have the client stand without assistance. The correct answer is option B. Use a transfer belt and proper body mechanics. A transfer, gait, belt and proper body mechanics protect both client and aide from injury. Pulling by arms can injure shoulders. Lifting under armpits can cause bruising. Standing without assistance is unsafe. Question 11. The nurse aide should report which change in a client's vital signs? Option A, pulse increasing from 72 to 76. Option B, blood pressure increasing from 118/76 to 126/82. Option C, temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. Option D, respirations decreasing from 16 to 14. The correct answer is option C. Temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. A temperature increase to 101.4 degrees Fahrenheit indicates fever and requires reporting. Minor variations in pulse, 72 to 76, blood pressure, 118/76 to 126/82, and respirations, 16 to 14, are within normal ranges and may not require immediate reporting unless accompanied by symptoms. Question 12. To prevent aspiration during feeding, the nurse aide should: Option A, feed the client lying down. Option B, feed the client with their head tilted back. Option C, feed the client in an upright position. Option D, feed the client only pureed food. The correct answer is option C. Feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 13. After giving a client a back rub, the nurse aide should always note: Option A, the last time the client had a back rub. Option B, any change in the client's skin. Option C, the client's weight. Option D, the amount of lotion used. The correct answer is option B, any change in the client's skin. The nurse aide should document any skin changes observed during a back rub, such as redness, dryness, or breakdown. This is part of routine skin assessment and helps prevent pressure ulcers. The amount of lotion used, last back rub, and weight are not the primary observations to document. Question 14. Range of motion, ROM, exercises are performed to: Option A, build muscle strength. Option B, prevent contractures and maintain joint mobility. Option C, increase weight. Option D, decrease appetite. The correct answer is option B, prevent contractures and maintain joint mobility. ROM exercises prevent contractures, permanent shortening of muscles, and maintain joint mobility. They are important for clients with limited mobility. Question 15. Which precautions are used for clients with MRSA or VRE? Option A, airborne precautions. Option B, droplet precautions. Option C, contact precautions. Option D, standard precautions only. The correct answer is option C, contact precautions. MRSA and VRE are spread by direct or indirect contact. Contact precautions require a gown and gloves for all client interactions. Airborne precautions are for TB and measles. Droplet precautions are for influenza and meningitis. Question 16. A client with dementia is pacing and appears anxious. The nurse aide should: Option A, restrain the client to prevent falls. Option B, encourage the client to sit down and rest. Option C, walk with the client in a safe area. Option D, leave the client alone. The correct answer is option C, walk with the client in a safe area. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Pacing is a common behavior in dementia. Restraining increases agitation. Forcing the client to sit may escalate behavior. Question 17. A client is pacing and appears anxious. The nurse aide should: Option A, ask the client to sit down. Option B, walk with the client. Option C, give the client a sedative. Option D, leave the client alone. The correct answer is option B, walk with the client. Walking with the client provides exercise, reduces anxiety, and allows the aide to monitor for safety. Asking them to sit down may increase anxiety. Sedatives require an order. Leaving them alone may be unsafe. Question 18. A client with dementia has difficulty eating. The nurse aide should: Option A, feed the client quickly to ensure adequate nutrition. Option B, allow plenty of time and provide cues to eat. Option C, puree all food to make it easier. Option D, skip meals when the client is resistant. The correct answer is option B, allow plenty of time and provide cues to eat. Clients with dementia need extra time and cues to eat. Example: pick up your spoon. Rushing can cause choking. Pureeing may be appropriate for some but not all. Skipping meals is neglect. Question 19. Which task is outside the nurse aide's scope of practice? Option A, applying a gait belt. Option B, recording output. Option C, changing a sterile dressing. Option D, offering a bedpan. The correct answer is option C, changing a sterile dressing. Sterile dressing changes require sterile technique and are outside the nurse aide's scope. Applying a gait belt, recording output, and offering a bedpan are within the nurse aide's scope. Question 20. A client's blood pressure reading is significantly different from the previous reading. The nurse aide should: Option A, ignore the difference. Option B, recheck it after 1 to 2 minutes. Option C, change the client's medication. Option D, document the first reading only. The correct answer is option B, recheck it after 1 to 2 minutes. When an unexpected reading is obtained, recheck after 1 to 2 minutes. The client may have been talking, anxious, or the cuff may have been positioned incorrectly. CNAs cannot change medications. Documenting only the first reading without confirming would be clinically incorrect. Question 21. The pulse deficit refers to the difference between: Option A, apical and radial pulses. Option B, systolic and diastolic pressure. Option C, radial and carotid pulses. Option D, brachial and femoral pulses. The correct answer is option A, apical and radial pulses. A pulse deficit is the difference between the apical pulse, counted with a stethoscope, and the radial pulse counted simultaneously. It indicates heartbeats not generating a palpable pulse at the periphery. Question 22. When assisting with meals, the nurse aide should: Option A, place the food tray on the bed. Option B, place the food tray within easy reach on the overbed table. Option C, feed the client immediately. Option D, leave the tray for the client to manage. The correct answer is option B, place the food tray within easy reach on the overbed table. The tray should be within easy reach so the client can self-feed if possible, promoting independence. Placing on the bed is unsafe and unsanitary. Feeding immediately may be unnecessary if the client can self-feed. Question 23. The nurse aide is caring for a client who speaks a different language. The best approach is to: Option A, use hand gestures and hope the client understands. Option B, speak loudly and slowly. Option C, use a trained medical interpreter. Option D, ask another client to translate. The correct answer is option C. Use a trained medical interpreter. A trained medical interpreter is essential for accurate communication. Hand gestures are insufficient. Speaking loudly doesn't help. Using another client violates confidentiality and may result in errors. Question 24. Which method of temperature measurement is considered most accurate? Option A, oral. Option B, axillary. Option C, tympanic. Option D, rectal. The correct answer is option D, rectal. Rectal temperatures most closely reflect core body temperature and are considered the gold standard. Oral temperatures are affected by eating and drinking. Axillary temperatures are least accurate. Tympanic readings can be affected by earwax and positioning. Question 25. When a nurse aide is floating to a different unit, they should: Option A, refuse to float to an unfamiliar unit. Option B, accept the assignment but only do familiar tasks. Option C, accept the assignment and ask for orientation to the unit. Option D, accept the assignment and perform all tasks independently. The correct answer is option C, accept the assignment and ask for orientation to the unit. Floating is normal, but the aide should request orientation to the new unit. Refusing may be insubordination. Doing only familiar tasks may not meet client needs.